Hello and welcome to Unfrazzle TV. My name is Emma Leavesley. I'm the woman that unfrazzles doctors. I'm a wellbeing and burnout coach for healthcare professionals. And this show is it's about everything wellbeing related for healthcare professionals, but anyone who's interested really. And we've got so many amazing guests lined up. And my first guest is here with me today, Dr Gabriella Day. Gabriella is a GP, a medical homeopath, and an author. And I have her book here, In Defense of the Realm. If you've not read it, I do recommend it. And we're going to be talking about the book, also the challenges in general practice, but in medicine as a whole, and what we can do to fix them. We've only got an hour, so we'll have to do our best with that. And also we're going to be talking about a new book that Gabby's got coming out, which is looking at bringing back the art of healing into healthcare. So it's really good to have you here with me today. Thank you for coming.
It's great to be here. I'm very excited to be here on your first episode. And yeah, I think rather than theory, we need to be a bit more kind of down to earth, don't we? We need to be actually meeting patients and people where they are generally, and not talking in highfalutin terms, but actual practical stuff that people can actually use that actually makes life better for people. So I think it's great that you're doing this actually.
And I think as well that all healthcare professionals are under so much pressure at the moment, and so are patients. So I think this kind of helps everybody. So I've given a brief introduction. Do you want to go into a little bit more details? Tell us a little bit about yourself.
Yeah, so I'm a GP, but my family background is very medical. So my dad was a GP. He died of swine flu back in 2009, and his parents and his brother were all vets. So the kind of medical thing is very much in the family. And I think veterinary medicine, might show my age, but like James Herriot, watching programs like that, and vets are very kind of practical and down to earth, aren't they? You know, they just have to get on and do it with whatever tools are available. And medicine's kind of gone a bit further away from that. You know, it's so easy to get into secondary care. My dad, particularly as a GP, was a very kind of practical, hands-on GP. And actually, if I'm talking family background, also my dad was severely dyslexic. I've got a severely dyslexic son, so dyslexia is strongly in the family, and neurodiversity as well, which I think probably shouldn't get too quickly into the subject of neurodiversity, but it presents huge challenges. But I think it's also got huge advantages as well. But I think too many people are suppressing themselves to fit in, and then not being able to make full use of their gifts, kind of thing. So that's probably another thing that I talk about in the book. But yeah, so I did hospital medicine, did MRCP. Couldn't really decide what specialty I wanted to go into, because there were lots of interesting specialties, but I didn't really want to do one all the time. And I found HIV really interesting because it covered so many different things. But I ended up going into general practice, because in general practice you see the whole patient, and the patient is your patient. It's not the disease or whatever, and you are actually trying fundamentally to help the patient in front of you to live their lives in a more fulfilling way. So I've been a GP, I think about 19, coming up 20 years now. So I don't think you realise, and it's probably the same for you, there's no kind of like you're a new GP and then all of a sudden you're an experienced GP. There's no kind of grading of it, is there? You suddenly realise that you've just seen a lot of patients, and you recognise a lot of stuff coming into the room, and you just gradually gain experience. And I would say the more interested you are in people, the more experience you're going to get, and it makes it more fun as well if you're interested in people, doesn't it?
Yeah, definitely. I'm a people person. I like talking to people. So that's why I went into mental health and everything that I did, to help people. But also, I really like that, getting to know the whole person. I think that's really important. Okay, so we'll talk about your book then, In Defence of the Realm. Do you want to give us a little bit of a whistle-stop tour of what it's about?
So it's actually a really difficult question to answer, and you put it nicely in your little brief, actually. But the reason I started writing it in my head was because I found myself saying the same thing to people over and over again, and then I started to kind of want to formulate what I was trying to say, and what I realised was that with anxiety and depression, but with a whole host of other things as well, actually, we're medicating people to deal with life when the circumstances that they're living in their life are inappropriate, they're dysfunctional, potentially abusive. Whatever's going on in life, they are feeling down, they're feeling low, they're feeling stressed, they're feeling overwhelmed because of the situation that they're in. And then they come to us, and then we then try to fix them with a medication, which is really undermining, actually, because they're actually doing a great job. They're working really hard. They're trying really hard. They're dealing with a huge amount of stress. And then when they come to us, we go, oh, you need a medication. And the medication might help them sort of for a while. But what we're actually doing is we're enabling them to continue functioning in a situation that they shouldn't be, a potentially untenable situation, which they should probably be leaving or changing in whatever way. And instead, we're just giving them medication. So so many people, we're actually treating them to fit into a system that is dysfunctional. So that now applies to schools. There's so many kids being medicated to be in schools. And I mean, I think with all these medications, there's a place for them. But you have to start wondering, if so many, particularly young boys, can't function in a classroom, what's the problem in the classroom? And yeah, I mean, there's the whole rat race and exploitation of people. You've got these massive companies that are making billions, and they're exploiting their workers, and so you've got loads and loads of workers who are just really overwhelmed, not able to cope with all of the demands, and then we medicate them. And that's not right. So in a way, the medical system's almost propping up this completely dysfunctional society. And a lot of my writing is often, I think sometimes what happens is some sort of situation is going on and I'm thinking, this isn't right. And then often like just something will pop into my head, like Krishnamurti, it's no measure of health to be well adjusted to a profoundly sick society. That you have to think, if we're having to medicate so many people to actually cope, where are we going wrong? Because this is, it's reached ridiculous proportions, hasn't it?
Yeah. And that was one of the things that really stood out for me in the book, because that's happened to me when I was working in the college before I burned out. I'd been to the GP, who was just like, oh, it sounds like you're under a lot of stress. Here's some antidepressants. And eventually I just had that breakdown where I couldn't go in anymore. And it was again, okay, well, this time we'll up your dose. Here's a sick note, have 2 weeks off. And then I saw a different GP who said to me, listen, if you go back there, it's going to make you ill. It's the workplace that's making you ill. So no amount of medication that I can give you is going to help with that. And that's when I made the decision, yeah, actually, I really can't go back to that job. And I think that's really important. But yeah, people shouldn't be, it shouldn't be normalised that you have to say that you're not coping. It shouldn't be normalised that you then give them a tablet to say, because you've said that you're not coping, if that makes sense.
Absolutely. I mean, I think it's critical that we start to think like that. And so when you come to sort of dynamics, we know that people's early life kind of sets up what they expect in life. So often, some kids will have been taught that they need to work really, really, really hard And if they work sufficiently hard, they'll be successful. Obviously, the implication of that is you're not successful unless you're working really, really hard. So your whole meaning in life is that I have to work hard to show that I'm a good person. So you've got some people like that. And then unfortunately, you have other people who are quite happy to abuse those people. But the person who is working ridiculously hard often doesn't actually realise that is an unfair use of power. It shouldn't be happening. It needs to be challenged. So obviously the ideal thing is that we ourselves realise that it's not okay. But actually, you know, in your case, one doctor said, you know, implied that it was fine and you just needed medication because you weren't coping well enough with the stress. Another doctor went, hang on a minute, that's not okay. And that's really, really important, because at that point you go, oh, so it's not me that's the problem. It's the, I mean, to some extent it's your problem because you didn't recognize it, but as soon as you recognize it, then you can actually deal with it. And I talk about this when actually, you know, if we go back to childhood, one of the things I talk about in the book is, if a child is abused in whatever way, if an adult comes in, so if there's an episode and then an adult comes in, sees that something has happened and says, oh my goodness, that, you know, that should not have happened. The perpetrator is removed from the situation. I'm so sorry, you know, I make you safe. I will make you safe. I will never let this happen to you again. They were wrong. The child goes, oh, that was wrong. It shouldn't have happened to me. I don't deserve that kind of treatment. And that child is, you know, more likely to recover than a child who the person comes in and they say, you know, it may stop, but they say, well, you shouldn't have been doing that. And so the you know, the second adult who comes in, who should actually be correcting the situation, kind of says, well, it happened because of this or that. And then the child thinks that's what I deserve. And the child then grows up believing that that is what they deserve. And so until somebody actually stops and says, hang on a minute, you don't deserve that. Everybody deserves to be treated with respect. Nobody should be worked into the ground. That's when that person can start to go, oh, hang on a minute. And, you know, a whole load of rewiring needs to happen in the brain so that they can realize that actually, no, I deserve better than that. And we really need that, you know, really generally in society, a real rebalancing. We're not actually supposed to be here to suffer. We are supposed to be here to, you know, make use of our gifts and to enjoy life. And we're not here to just be oppressed. And, you know, there's the sort of church, the viewpoint of the church that has been kind of perpetuated is that if we suffer enough and we allow ourselves to be sufficiently oppressed, we'll go to heaven. But that's not actually correct. So I don't personally believe that you can doormat yourself to heaven. You know, part of your lesson on the way there is actually to learn that you do not deserve, that's not what you deserve. You deserve to be, you know, a joyful, happy person who can shine out with all of their gifts. So yeah, the book is actually trying to say to people, you are an amazing and wonderful person, and you deserve to be treated as much, and you have a right to defend your boundaries and to try and ensure that can happen.
Yeah, and I think it's a big thing in medicine as well. A lot of my clients have that belief of the fallacy that if you work really, 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 really hard, you're going to get a reward, when it just makes you open to abuse, really, and overworking and burnout. So I think that's something that's really important too. In medicine, there's this culture of almost, well, it's just brutal, really, isn't it? It's abuse. It's a abuse of the staff in healthcare across the board, but it's treating people like they're not human as such. Just being made to work and deal with horrific things, be traumatized regularly and just put up with it.
Yeah, and the attitude, you've got patients who are saying, on the one hand, they want to have a human being, they want to have the empathy of the human being, but then often treating the doctor. I mean, I know somebody I worked with for a while actually said to a patient, well, I am human too.
Mm.
And if you want, I mean, you can replace us with AI, which is what they want to do. But, if you replace us with AI, there'll be no comeback, because if the computer says no, the computer will say no, and there'll be no saying, oh, but this and oh, but the other.
Yeah.
But I think all practitioners are also patients, potentially. We're all patients. And I think in restaurants and stuff, you have that idea, don't you, that the customer is always right. Well, that can't be the case I mean, I don't think that's completely the case in the restaurant, because you shouldn't be abused by anybody anyway. But but I think one of the things that we need to do is start looking at the dynamics that are going on in consultations. Because you do get a lot of there's a significant number of patients who abuse the system. And they can be very conniving and manipulative. It can be very sort of, oh, I need this and then I need that. But there was, I can't remember which play, I think it was an Antonin Chekhov or something about power plays. So the person, and the spider chapter talks about this a bit, but one person can be saying, oh, but I need this, I need that, and then everybody else is jumping around, dancing to their tune and giving them what they want. If you look at the words of the consultation, you might say, oh, that poor patient, they're really suffering. But if you actually perceive the dynamics, it's the doctor who's being pulled from pillar to post and stretched and absolutely taken to pieces by the ridiculous demands of the patient. So, and it comes back to what you were saying, some people working really, really hard. So you get some doctors who work really hard, they give as much as they can, they always want to help. And then you get another doctor who's always gone at 5 o'clock, and if something hasn't finished something, it doesn't matter, they're gone. And who do the staff come to when they've got a problem? They come to the hard-working doctor. They don't go to the one who, because he's already gone. I shouldn't say he or she has already gone. So they come to the hard-working doctor. So it just gets more and more, and so that person gets away with more and more, and then you end up with more and more on your plate, and that's not fair. And I mean, when I'm working in a group like that, I do tend to try and keep an eye on the overview of, what people's workloads are like. Because actually, if you've got somebody, if you look at somebody, it might look like they haven't got that much to deal with, but they're clearly really stressed and struggling. They need some help. And there might be someone else who appears to look really busy, but they don't look at all stressed. Like, well, they seem to be okay. So you do have to kind of not just look at the workload, but look at the effect it's having on the person. And if somebody's struggling, then you need to help them out. And you need to look at the systems that are causing them to struggle and everything like that. But we need to be looking at the energetic impact on people of what's going on. And, they talk about with women, don't they, the mental load. Often women are carrying a much bigger mental load of all sorts of things to do with the children. And, just from a personal perspective, I know there is still a kind of entrenched attitude, I think, amongst some administrative staff, that they will do all sorts of things for male members of staff that they wouldn't do for female members of staff. And actually also that female members of staff will often do those things themselves because they feel like it's part of their job. Whereas the male will be like, it's not my job. And that's not universal by any means. That's, a complete overgeneralization. But, if that's unconscious, and I think often it is unconscious from the admin staff or whoever, we need to bring it into the spotlight and say, look, have you noticed this is happening? Because if we notice it, we can actually do something about it. The trouble is often we're so busy on the treadmill, aren't we? We're just going, and we don't take time to stop and look and go, well, why am I like this? And someone else is, sat back with their feet on the desk in the meantime.
Yeah. And I think, without going too much down the role that women play in society, I think that there is that, definitely, that women have a much bigger emotional burden generally at home. So if you think of it, it's like, okay, women generally orchestrate the entire household remotely while doing a full-time job. I know that's definitely been what I've done. So it's like, right, okay, I'm working full-time. I've got to sort out a babysitter. Childminder's cancelled. I've got to sort that out. Child's home, being sent home from nursery, throwing up. I've got to go and sort that out. And then, I mean, the job that I worked in that caused me to burn out, I actually got told off for having a day off because my son wasn't allowed in nursery because he was vomiting. And he was like 4 months old. So I was thinking, well, what am I supposed to do with him? I can't leave him on his own. But it was very much that, well, you should make other arrangements. But
you're becoming the shock absorber, aren't you?
Yeah.
Your son can't miss out and work can't miss out. So whatever happens, if I'm being compressed from both sides,
Yeah.
I'm going to get completely squeezed out of this situation and have no life whatsoever.
Yeah.
But they'll get what they want and they'll get what they want. But I will be left, like flat in the middle of it.
Yeah, absolutely. Going back to the book, this leads quite nicely into it. One of my favourite bits, which really struck a chord, was when you were talking about, because there is quite a lot of religious analogy in there. So there's a bit where Jesus goes into the temple and he's like getting very angry on behalf of others. And the book is saying that we have like righteous anger for other people when they're being abused, but we let ourselves put up with so much and we don't speak out, and we're colluding with the abusers really because we're allowing it to happen to us. And I think from reading the book, definitely it's what I tell other people, but put a lot more poetically in your book. It's what I tell other people, but I did notice that reading your book, I was like, right, I'm not going to tolerate being spoken to like that. And I did actually say that, no, like, you're not speaking to me like that. Who do you think you are? But in a nice way. And I think that that's something that we're probably all guilty of, but some people more than most. I think some people have that personality where, and it's like you were saying, due to early childhood experience, that you don't speak out for yourself. Even professionals who have gone through so much training. I mean, I've studied psychology, and it's, I think we just allow other people to take the mickey basically, and
we do. I mean, I would say that we're not colluding until we realise what's happening.
Yeah.
But once we realise what's happening, then we assume responsibility for it. So when we don't realise that's what's going on, we're oblivious. You can't have any control over it. But once you realise what's going on, then it is your responsibility to say, actually, no. And I think a lot of high achievers are probably susceptible to it because they're high achievers and they've always been able to jump through the hoops and they can work really hard, but also their identity might have been formed by the fact that they're capable of jumping through hoops and they always cope. And so they've been taught that when I cope, I get positive feedback. So I just have to keep coping and everybody will think I'm a good person, or I'm good. A good person, I think, is generally what it is. It can be just a successful person. But so I have to always be able to cope. That's how I form my identity, and we've been taught that is the way to be. And so you can deal with these multiple demands, because if you weren't capable of doing it, you'd never have got into it. But the trouble is, you're like, oh yeah, I can add this into my schedule. I can add that in. I can add that in. I can add that in. And they're all small things. But then before you know it, what gives? What's the because basically it ends up being your sanity that gives.
Yeah.
And I think, I do have some concern about, I think a lot more women are more likely to be diagnosed with bipolar disorder. And of course, that's one of those conditions where there's not a clear cutoff. With the sort of most extreme forms of bipolar disorder, it's a profoundly different condition, but the cutoff between just complete overwhelm from a ridiculous number of, because this is, you know, when you were talking about stress, so you're under stress, so they send you on a stress management course.
Mm.
You're already really good at dealing with stress, so you pick up a few extra tips so that you can deal with even more stress.
Yeah.
So before you know it, you've trained yourself to deal with all the stress that people can throw at you. You're like, okay, I can deal with it, I can deal with it. But then if something goes wrong in that, there's no buffer zone. You know, that's it, and there's nowhere to go with that. So then, yes, you're overwhelmed, and then you may appear hysterical, and you may be erratic, and you may get a diagnosis of bipolar disorder, and it's purely because you've been subject to overwhelming demands. I mean, I do talk about the women bit in the book, don't I? About you know, the hysteria.
Yeah, yeah.
And
the floaty womb.
the floaty womb, exactly. So when you get distressed at work, and then of course, because you usually hold it all together, so when you get distressed, then you know they're like, oh, she's got a bit hysterical, and then you know, and the attitude, rather than if you were to shout at everybody, you know, everybody might cower and do as you ask, but because you don't want to shout at everybody, because you're you know, you like to be nice to people, you end up just behaving in a way that everybody thinks is erratic. So they think, oh, she's just lost it. It's a hormones, and then ignore the actual original problem. They just put it down to your hormones and ignore the fact that there was actually a problem that precipitated me getting overwhelmed.
Yeah. Definitely. And I think somebody posted on Facebook, and I completely agree, that as your estrogen starts to reduce, so does your filter. So basically, I've found this definitely with myself. Going into perimenopause, it's like, no, I'm just going to say what's on my mind now. I don't, yeah.
That's interesting, because I'm just thinking about that. I mean, you need a lot of patience to bring up children, don't you? So I guess estrogen probably helps you be patient with your children, but it also helps you be patient with all the other people who are behaving like children in the workplace and everywhere else. And then as your estrogen drops, your children have grown up, so they can hopefully act like vaguely adults because you've taught them to act like adults, but all the other children around you at work, they're acting like children, and so they then get both barrels, and some of them deserve it.
It's an interesting design in humanity, I think.
Yes, maybe that's not an accident.
Maybe not.
Yeah, indeed.
Okay, so going back to the book, one thing that I really did like about it was right at the beginning that you said, take your time, just read a bit at a time, really absorb it, because it's full of truths that are it's what you need to hear. A lot of it is what you want to hear as well, but some of it is quite hard to hear. And I think I read it around about the right time, not wanting to turn this into a personal therapy session, but I think it helped with the realization that I'd tolerated a lot where I really shouldn't have been doing. And I think that with some of the chapters, because it took me a while to read, it's like I really need to actually not just read that and move on. I've got to do something about that. And I think that's really good that you're invited to do that rather than try and read it in one go, because there's so many aha moments in the book. And I think it's useful for anybody because, as I say, it's all the things that I've been telling people to do for years. And we sometimes give good advice, but don't take it on ourselves. And I think sometimes we need to hear that from somebody else too. So I think that's really useful. But I think that the book really does highlight that it's the little things that we normally would just go, okay, right, yeah, that's annoyed me, but I'm blowing it out of all proportion if I say anything about it, and we let things slide, and that can chip away at you over time. And then you look back at who you used to be and realise that somebody's taken that away, and you've gradually been made to tolerate more and more and more and more, and you can lose that sense of self. And it's certainly something that I've been thinking of quite a lot in regards to relationships. So yeah, I think this book kind of really came along at the right time. So yeah.
Yeah, that's good, because I mean, I think, you know, when you're in a new relationship, you know, there's that tolerance, isn't there? And again, that's more female. Oxytocin kind of lets you tolerate stuff, but then you kind of settle into stuff. And you, again, if you want to be helpful, you allow somebody this. And of course, in a relationship, it is about give and take. So there's going to be times when they're not on form, and there'll be times when you're not on form, and there'll be times when you do a bit more for them because they need you to, and times when they do more for you. But it should be give and take. And if it gets to the stage where the other person is taking all the time and you're not, when you realize that's happening, it's you have to step up and challenge it. And if you step up and challenge it to the best of your ability, and then it doesn't change, then you have to think, you know, do I continue to accept that this is okay, that this is a good way for me to be treated? Or do I say, actually, no, I'm not having it? You know, so there may be some kind of point where you reach an ultimatum that you say, you know, if this doesn't change, actually, this isn't going to work. But hopefully what happens is, because you're actually giving the other person the opportunity to change, if they've never realized what they're doing, it's a gift to them that you're actually, you know, I think I mentioned in the book, Paramahansa Yogananda talks about a relationship. It's like two jewels, and they're kind of rubbing against each other, so they'll become sort of beautiful gems. So in that kind of close relationship, you're actually giving them, helping them to grow, and they'll help you to grow. As long as it's as long as there's enough give and take from both sides, because if there's not, then you get resentment, and if you get resentment's really bad for you. I mean, resentment causes a whole host of issues, and makes you extremely irritable towards everybody else, towards your children, towards your work colleagues who don't. And this is how all the kind of energy gets really sort of convoluted, because, you know, you're having problems in your relationship and you don't stand up to address them, and then as a knock-on effect, your children are suffering and people at work are suffering, and then other people at work might be trying to compensate for you, and then going home and having an argument with their other half. So that's why it's about awareness, because the more aware you are of these kind of dynamics, and feelings are really important in that, because if you notice you're feeling resentful, you can stop and say, why am I feeling resentful? What's going on? Is it actually relevant to this situation? Is this the person who's caused me to feel resentful, or is it actually, you know, another situation, I'm feeling resentful about something else and I'm just being irritable with this person? But unless we're kind of try and become aware of what we're doing and look at it, and of course that's why therapy is helpful, isn't it? Because it gives you a chance to open the box up and just kind of have a look at it, and then hopefully when you have a look at it, you go, oh yeah, no, that makes sense. And then you can go and do something about it.
Yeah, definitely. Okay, we're going to tackle the big one now then. So the morale in the NHS is very low at the moment. That's putting it lightly. From your perspective, what are the main challenges, particularly in general practice?
I mean, it's not simple. There's lots of different aspects to it, which is, you know, a big aspect of it is that there's been a massive increase in anxiety and fear since COVID, and you know, constant fear generating headlines and things, and so people have kind of lost faith. In COVID, there was a huge amount of changing of the rules all the time. So it basically was, it's kind of like shifting sands under people. So where in the past they might have been able to judge whether they were ill or not, they were kind of taught that they had no idea if they were ill or not, and they needed to go to the doctor to find out if they were ill or not. when they go to the doctor to find out if they're ill or not, the doctor's been subject to exactly the same conditions that have caused the patient's anxiety. So the doctor's going to be anxious as well. And then what you're saying as the patient is, oh, can you take the anxiety off me? Because you're either going to say I'm fine and not worry about it, but then the doctor has to go away with that anxiety, or you're going to say I have to go to hospital, and then you generate lots more anxiety. So huge amounts of, because social isolation, people being isolated from their families is bad for their mental health, causes fear, anxiety, but it's also bad for the immune system. So it actually makes you more susceptible to illness. And, you know, neuro, immunological access, you know, emotions have an effect on your immune system. So they you know, they cause all sorts of knock-on effects. There's also, I mean, the huge amounts of stress that people are under that are nothing to do, you know, there's societal problems, but there's societal problems that are not being addressed, and then people are coming to the doctor to have them fixed, but they're not really medical problems. And then, you know, obviously people being sort of immersed in the online environments and separated from their communities. So in the past, people had their sort of communities, didn't they? Their extended families, when you had cottage industries and everybody would have supported each other. And then there was the complete disruption of all of that with the Industrial Revolution. Everybody moves into cities, but also with people going off to university, you get people separated from their families. So they're on their own. So they don't have that cohesive network of support. And then, you know, so they're isolated online, interacting with people online, you know, not real people, not getting real proper feedback. We also know that touch, you know, it's really important to, you know, have a hug from somebody occasionally, just to be with someone. I mean, if you only meet up with someone because you make an agreement to meet up with them online, that's not the same. We know that people live longer when they are happily married and different things like this. So this is all making people more unwell. The huge amount, the consumerist society, so everybody's looking for happiness in the next Amazon Prime delivery, which is never actually going to bring them happiness. So they're spending all their money on stuff that's never actually going to bring them what they're looking for. So then they're depressed, so then they come to the GP because they're depressed. Eating rubbish, because, you know, if you haven't got much money and the only thing that's available is rubbish, which causes all sorts of gut problems. So everybody's got gut problems. And then, I mean, this is a big issue, is that you've got the patient coming to the doctor because they've got a symptom that they want the symptom to be improved. The doctor's agenda, because they've been filled with fear and anxiety and, you know, medical legal things hanging over them all the time. The doctor wants to make sure that they're not going to miss cancer or, you know, a serious diagnosis. So each time the patient goes to the doctor wants to just ensure that they haven't got these serious diagnoses, and then they say it's nothing, you don't have to worry about it, but the patient's still got the issue, which the NHS doesn't necessarily have the tools to address, all that disruption of the microbiome and the motor complex and everything in the gut that causes us, you know, there's so many other things that can be done that isn't necessarily the place in the NHS. So and of course the diets are causing diabetes, obesity, and natural light is another thing I've been looking at recently. Natural light is really important, and blue light is really bad for all sorts of things to do with sort of our metabolism and weight gain, weight loss, and mood and all of those kind of things. So when we're sort of indoors all the time online, we're missing out on natural light, which has health benefits. So there's that aspect, and all of those are things that actually, you know, that information should be disseminated just more widely, rather than people having to go to the doctor. But the implications of it each time they come to the GP. So the GPs are just overwhelmed with all of this demand. And the other thing is, you know, in the past, people would have gone to their spiritual leader for advice on life stuff, but now that doesn't happen. They don't have it. So it's kind of like medical, but then a lot of, and you know, this is a fundamental issue. The next book is actually Heart-Based Medicine, which will be out very soon. And then it will be Restitution, Rebalancing the Art and Science in Medicine, but they're both kind of similar. The doctors sitting there with their agenda of, you know, I've just got to make sure that the patient doesn't die, and that I don't get struck off, and that I am prescribing according to the medicines management stipulations that I've got to be in accordance with. I've got to tick the right cough boxes because otherwise I won't get paid. I've got a meeting to get to, I've got kids at home who need me. So that the doctor's got all of these things going on in their mind. And they're like, well, I've got sertraline or citalopram or counselling, what do you want? I saw somebody last week, and I actually got a thank you afterwards, because I'd actually just listened to the problem. And the thing is, it's not rocket science. We can all do it because we're all human beings. We can listen to somebody's problem. We don't have to fix the problem, but when we give them the chance to speak out their problem and explain it and just maybe reflect it back to them a little bit, they can then often deal with it themselves. And I think something that we're really not doing is empowering patients. We're teaching them that if they've got a problem, they need to come to us, and then we'll give them a drug. So they, you just had an antidepressant deficiency, and now we've given you an antidepressant, so you should be fine. If we're actually empowering people, they're not going to come back and come back and come back. If we teach them that they need us to solve everything, they're going to keep coming back because you've taught them that's what's needed. The more we can get patients to kind of take responsibility for their own health, we've become a bit sort of, I don't know, like the inquisitorial squad. We're constantly chasing everybody because their blood pressure's not to target and their cholesterol's not to target, and and they're just like, and we haven't done their smoking cessation advice or their alcohol cessation advice, and the patients are like, I'm in an abusive relationship, I've got 6 children, and I don't know how I'm going to feed them, and you're telling me to stop smoking. So we've got completely different agendas, and so if we can just stop and listen to people, that can actually be really helpful. But I know a lot of GPs, they kind of think, well, I can't fix their problems, I don't want to open that box. But if they don't open the box, so the book by Nick Reed, Sick and Tired, talks about how people who need something, they will keep coming back and they will present what we want to see, so that they get they think they'll get their need met. So in the past, that might have been convulsions or heart issues or whatever. It kind of fits what the medical profession is interested in at the time, and they will just keep coming back until somebody actually meets the underlying need. And all we're doing, if we're just fobbing them off each time with another pill that doesn't actually address the underlying need, then we're not going to improve matters. So sorry, lots of different things.
Yeah.
But I think one of the key things, I think, is actually really connecting with people, like we were saying at the beginning. If you connect with somebody and they actually feel valued for that time while they're in your room, and they felt like you were pleased to see them, that you actually had a sort of genuine, heartfelt interaction, they actually go away. That gives their immune system a boost. That makes them feel better. And if we can engender that feeling in them, that can go away, and they go, actually, I am an okay person. I am doing, I might be under stress, but actually I'm doing an awful lot. The Samaritans don't try to fix stuff. They just listen. And I went to a talk with them, and it was fascinating because they just make no attempt to fix anything. They just listen. And yet people find that really helpful. So we can do that. It's actually, it's quite easy to do. And I don't think it actually, or it might take longer in the first consultation, but actually if you listen into the cues, if you listen to where people are showing signs of distress or discomfort or whatever, you can often get quite quickly into the heart of the matter. You can find out what the real issue is. And if you can find out what the real issue is and address that, then you don't have to do all the messing around with all the other stuff that they feel that they might have to say to get in through your door. That makes sense.
Yeah, definitely. And as we've talked about before, there are a lot of somatic issues involved with some mental health problems that are caused by what's going on around them too.
So that's really complex, because actually, there are people who are, they are purely fabricating an illness for attention. There are people who need something but don't know how to express it, and might be, you know, that there will be people where there is no awareness that that's how it's coming out. And there are loads and loads of conditions, you know, we can't get away from the fact that if we don't deal with emotions, they cause problems in the body. And I think if, for example, self-hatred, you know, if you hate yourself, that's a really bad start. And that's going to have negative effects on your system. And that will produce symptoms. And it will cause, it can lead to physical symptoms. So it's not even saying that, so it's, symptoms can be caused ultimately from the consciousness and the mind, and they can bring about physical symptoms. So the patient has physical symptoms and they are real symptoms, but that doesn't mean that we can't improve those physical symptoms through looking at aspects of stuff that's going on in their consciousness and their well-being, and changing other things in their life. You know, if the distress is coming out that way, you know, get to the source of the distress and see if we can deal with that. And then often physical symptoms will improve. And that doesn't mean that the physical symptoms weren't there in the first place. It doesn't mean that they were making them up. They were there, but it doesn't necessarily have to be addressed with a medication or a suppressant, symptom suppressor.
Yeah, definitely. I think that it's like we've mentioned when we've chatted before, they're seeing the whole person rather than just looking at symptom by symptom.
Yeah, and this is the thing. So this is why the book is In Defense of the Realm. It's the mind, body, and soul. And the idea is that, you know, the symptom comes out, but you've got no idea where that symptom has really originated from. So if you just suppress the symptom, it's like playing whack-a-mole. You suppress the symptom, and something comes out somewhere else. So, you know, we can't. It's chaos theory. Butterfly flaps its wings somewhere, and thunderstorm happens somewhere else. What we do to the body and what we do to the mind, we don't necessarily know how it's going to express itself. So if we just deal with the you know, the simple presenting complaint that it might appear to be, and we don't deal with the underlying cause, it's just going to keep popping up. And if we just try and when you're looking at sort of physical versus spiritual, if we just address people's physical illness, this is what happens, is we have this escalating like demand, this tsunami of need that we have, and much of that tsunami of need actually requires an emotional, mental, spiritual answer. And if we only deal with the physical, that doesn't go away. And when we push people away, so this is very much what I'm talking about in heart-based medicine, when we keep people at a distance, the demand doesn't go away. They just keep trying to get in a different way. It's like a child, you know, we know that children play up to get attention. If they're not getting attention, they'll play up to get the attention. There's a need there. I need something, and if you just keep me away, it's not gonna meet the need. You know, and if we look at AI tools that are kind of, you know, they might analyze the e-consult or whatever they do, they'll say no clinical need. The patient doesn't clinically need to be seen today. But actually, if you look at the emotional stuff that's surrounding it, it might be evident that if you don't see this patient today, that situation is going to escalate. Or, you know, there's so many scenarios where there may not be a clinical need for them to be seen today or at all clinically at the moment. But if we don't nip this in the bud, it's going to cause more demand later on. So why not meet it there, where we can actually, you know, the patient then feels heard, they feel reassured or whatever. We can empower the patient to deal with their problems. We really need to be thinking it, you know, because if we're thinking long term, we shouldn't be just thinking each consultation or request for a consultation. We shouldn't just be thinking, is there a clinical need? We should be thinking, the way I deal with this inquiry at this point, is this going to escalate overall demand on the system, or is it going to reduce it? Because if you can see that if you don't deal with it, they're going to end up in A&E, then A&E going to send them back, or, you know, it's going to be another 3 or 4 interactions, then it makes much more sense to deal with it on the day. And within that, demand day to day varies. And so when I'm thinking about clinicians, there'll be days where you're just like, I can't deal with it today because I'm up to here, so I can't deal with it. Well, that's okay, because it doesn't have to be dealt with today, so it can be put tomorrow. But you just have to add that in. You know, if I've got capacity today to do this thing, which isn't, you know, there's a clinical need, but it would make sense. If I've got capacity, I'll do it today. And if I haven't got capacity, well, we'll put it. And then it again involves clinicians working together, so not leaving one person to be the full guy who ends up picking up the pieces for all of the sort of emotionally distressed people who haven't been attended to, because that's abusive of that worker. You know, everybody has to work together and kind of take their share of it.
Yeah. Okay, so we're into the last 10 minutes. Tell us a little bit about the book. You mentioned there's 2 books coming out.
Yeah, so the first one's Heart-Based Medicine, Reviving the Soul in Medicine. And the reason I wrote that one is it's a shorter one. Basically, I was doing visits around Southampton, and it's really interesting because you get a real overview of how different practices are functioning. And, you know, some of the ways that things like, you know, people denied a visit because there's not the clinical need, but actually, you know, end of life, or all sorts of things where you're like, this isn't actually, you know, there might not be a clinical need, but actually, if you're a human being, you can see that there is a need here. And, you know, if we can kind of put a name to that, because I think there's lots of clinicians who would be like, well, I feel like I ought to visit this patient, but nobody else would think that they ought to have a visit because they don't, it's not really necessary. And they'll feel bad, like, oh, maybe I'm just not tough enough. Maybe I'm not, you know, my clinical acumen isn't as good because I feel like I ought to go and visit them. When actually in that case, it's their heart telling them this person actually does need a visit. And if we can kind of give that a name and say that's what we're doing, and then, you know, when I did this one-on-call session where I was in the base, it was out of hours, and there was another clinician doing the visiting who didn't do a visit all day. She didn't go out to do a single visit all day. And when I saw a paramedic the following day at Cubs, and she said that the Monday had been the most horrendous day. It was so busy. And I thought, oh, it's interesting because I was out of hours yesterday and our visiting doctor didn't do a single visit. Now, if you go back through the notes, all of those refusals of visits can probably be clinically justified, that they didn't clinically need a visit at that point. But they're denying some kind of need, they're turfing it onto another service. You know, that's not heart-based medicine. I think if we can put some kind of name to that and enable people to see what's going on and think about it slightly differently, we're not just clinical automatons, we are feeling human beings. So that's how we should be operating. And if we don't operate like that, that's going back again. If we address people's emotional needs as well, we'll reduce the demand ongoing. And then the other book is Restitution, Rebalancing the Art and Science in Medicine. And that one is, it covers a lot more subjects, but it talks about sort of reading into the dynamics of a consultation, you know, the energy in a consultation. There's a chapter in there on diagnostic labels, actually, which I think is quite an important one, because we're quite simplistic about certain diagnostic labels. Like, we give people these labels and then it's assumed that they need, you know, they're more deserving in some way. And yet all of these things, you know, there will be people, for example, with autism, ADHD, with cancer, with, you know, any condition, it doesn't matter what condition they have, you'll still get people within those categories who manipulate the system, and you'll still get people within those categories who won't ask for any help when they actually need stuff. So we still need to be really discerning, and we can't just decide on the need on the basis of the diagnostic label. We have to actually be reading the dynamics in much more detail to see what's going on. I mean, I've always kind of thought with emotionally unstable personality disorder, you tend to get some people with emotionally unstable personality disorder blame everything on themselves. You know, there's a lot of self-harm, but they're not kind of attention seeking so much that, you know, that They're harming themselves because they can't deal with something, but they're not actually trying to put other people out. They're trying to actually avoid putting other people out, but it kind of happens if they're self-harming. And then you get another group of people with emotionally unstable personality disorder where everything is everybody else's fault. They blame everyone else. They take no responsibility for anything themselves and make everyone else's life a misery. So often you get, different types, and we can't just look at labels. If we just look at labels, we'll get manipulated. We have to be reading people a bit differently, and we have to be like, is this person actually genuinely distressed? And if they are genuinely distressed, can I find the underlying cause of that and help them with that? If they won't let you, well, you can't help it. But if they're actually using whatever diagnosis to manipulate you, because some of these people will be a huge drain on the NHS, using up massive amounts of resources. And yeah, you can't just use the diagnostic label to decide who's, to determine whether you should be doing something. I mean, that was another thing I was thinking about the other day, is when we say, I should be doing this or I shouldn't be doing it, we need to think, the next question is, well, why shouldn't I? If I shouldn't be doing it, who should be doing it? Should it be being done at all? Is this something that the health service as a whole shouldn't be doing? And actually, should I be standing up to this patient and saying, actually, no, that's enough. You don't treat the service like that. What else? It covers lots of different topics, restitution. Yeah, but I think it's really, what I'm kind of asking people to do is, like, in the past, so you had the shaman in the past who would look at the patient, look at the person, they would look at their physical ailments, but also their, what was going on with their emotions and spiritually. Even further than that, they would actually, sometimes the illness might be a representation of a disturbance in the tribe or society at large. That's all kind of gone by the wayside. And even, 100 years ago or so, there was much more about listening to the patient, and we've got all of the Balaam stuff from, that's not that long ago, and yet we seem to be being pushed more and more into being these clinical robots. And the trouble is, if we behave like clinical robots, we will be replaced by AI, because AI can do that. And a huge danger for us at the moment is that if we get sucked into the trap of saying, we'll use AI because we're overwhelmed, so we'll use it, it won't just be used to help us out to make our workload easier. It will then, it's like the supermarket checkouts. People on the supermarket checkouts, they think, oh, if the supermarket checkouts get automated, then we'll have more time to stock the shelves. No, they won't. The supermarket will get rid of them. They'll just have fewer people. They'll still work you just as hard. The AI is not going to reduce the workload. It will allow the people who were there to do more complex stuff, but it would also allow them to get rid of a lot of doctors as well. And I don't think anybody would say, I mean, AI has its uses, but do you want an AI doctor? Do you want something with no feelings to actually be dealing with your case? I think that is a road we really, I certainly don't want to go down it.
Yeah, I mean, even just thinking, if you were being given a serious diagnosis, who would you want to tell you that? I wouldn't want a robot to tell me that. I'd want a human to tell me that.
Absolutely, because I mean the connotations, and this is another important point, which probably haven't got time to cover it. I read a brilliant book, Tyranny of Health by Dr. Michael Fitzpatrick, which was actually written in 2001, and he talks about the adventure of the human spirit. That's what this is. It's the adventure of the human spirit, and we have a body. So we're actually on the planet, we have a body, and it has physical ailments, and it's good to have medicine to help with the physical ailments that as they come along. But we're not just this physical body. If we were just this physical body, then yes, preserve the body, make sure, just like a car, make sure everything's in the right place and oil it and make sure it's all working fine. But it's just the vehicle for us to have the adventure of the human spirit. And when you get a diagnosis like that, that's then life changing. That has implications. I mean, a lot of the implications might be, I just want to spend more time with my family. With a significant person, life is about connection. Life is about love. There's all these things that are important in my life, and that's the key thing. We're not here to have a clean bill of health, are we? We're here to keep our bodies in good enough functioning order to allow us to do what we want to do with our lives, whatever that may be. And yeah, I mean, I think restitution is about that. It's partly saying, it's not all about preserving this human body. There's more to life than this, and the medical profession needs to, the whole attitude that nobody's allowed to die is daft, because it's not actually, it's not possible. But also, if people are not living their lives because they're so busy worrying about their health and attending to their health all the time, then there's no point in being here anyway. So what's the point in your physical body?
Yeah, exactly.
Yeah.
So when is the book out?
So Heart-Based Medicine is the publisher is finalising the cover now, so I'm hoping that should be out in the next month, so before Christmas. And then restitution. So I'll start finalising restitution after that. I mean, it's written, but I just need to get it all. It takes a long time, doesn't it?
It does. Yeah.
The hard work is kind of like, you have the idea and you put the idea down on paper, and then I'd really like somebody else to just take it and deal with it all, but you have to do it, don't you?
Yeah, the coming up, I love the coming up with the idea. I even like the writing it. It's everything after that is, yeah, I'd rather someone else did that for me.
Attention to detail, as I say to my children, attention to detail, attention to detail. But like, and funnily enough, I edited somebody else's book for him, and I mentioned it to my sister, and she said, so when did you get time to edit his book? And I'm like, yeah, editing someone else's book is so much easier than editing your own, because you get to read somebody else's ideas, and it's great fun editing somebody else's book, and then when you come back to do yours, it's like, oh no.
So I have put your website address in the show notes. You can get In Defense of the Realm on Waterstone's website, Amazon as well. I do definitely recommend it, and we've got these two other lovely books coming out as well. That's something to look forward to, and I'll definitely be reading those too. It's been absolutely amazing. Thank you so much for coming on my first ever episode of Unfrazzle TV.
Thank you, and I can't wait to see the next one. I know you've got another one lined up for, is it next week?
Yeah, I've actually got a bonus one on Wednesday where I'm going to be interviewing Frida, who is she was a mental health nurse. She's now working as a first responder for the ambulance service, and she's a coach, and she has just done a TEDx talk on who's caring for the carers. So she works with professionals in both health and social care. So that's the next episode, and I'll be back on Monday with Dr Ranjsagua on Monday, who is a hypnotherapist, GP and coach. So yeah, and there might be another bonus one this week too. So we'll have to look at that. So yes. Anyway, thank you very much.
Thank you.
And I'll see everyone on Wednesday.
Bye-bye.